Question 1. A pathologist performs a gross and microscopic examination of a breast biopsy taken to investigate a suspicious lump. The specimen is identified as a single-core needle biopsy. Which CPT code should be reported for this service? A. 88302. B. 88304. C. 88305. D. 88307. Answer: C. 88305. This question tests your ability to select the correct surgical pathology code based on the specimen type. The key term is breast biopsy, which is explicitly listed as an example under CPT code 88305, a Level 4 surgical pathology service. Codes are assigned based on the complexity and work involved in examining the specimen, with each level, I through 6, corresponding to a list of specific tissue types. A breast core biopsy requires more detailed examination than a simple skin tag, Level 2, but is less complex than a total mastectomy, Level 6. Always remember to consult the CPT codebook's list of examples for each surgical pathology level to ensure you choose the correct one. Question 2. A patient undergoes a series of blood tests ordered by their physician. The lab performs a comprehensive metabolic panel, 80053, and also a separate, medically necessary test for total bilirubin. How should these services be coded? A. 80053, 82,247-59. B. 80,053. C. 80048, 82247. D. 80053, 82247. Answer: B. 80053. This question addresses the concept of CPT panels and unbundling. The key is knowing that a total bilirubin test is already included as a component of the Comprehensive Metabolic Panel, CMP. CPT guidelines state that you cannot report individual component tests separately when a panel that includes them is performed. Therefore, billing for both the CMP and the individual bilirubin test would be considered unbundling and is incorrect. To code correctly, you simply report the most comprehensive code that describes all the services performed, which is the CMP 80053, in this case. Question 3. During an open-heart surgery, the surgeon removes a suspicious aortic valve and sends it for immediate pathologic consultation. The pathologist prepares a frozen section, examines it microscopically, and reports the findings directly to the surgeon in the operating room. Which CPT code describes the pathologist's intraoperative service? A. 88305. B. 88329. C. 88331. D. 88309. Answer: C. 88331. The concept here is coding for intraoperative consultations, which are urgent services performed while a patient is still in surgery. The keywords immediate pathologic consultation and frozen section point directly to code 88331, which describes the first single specimen block examined. This service is crucial as the pathologist's findings can change the course of the surgical procedure. For instance, if the frozen section reveals malignancy, the surgeon may decide to remove more tissue immediately. Always remember that 88331 is the base code for an intraoperative frozen section, with an add-on code, 88332, used for each additional specimen. Question 4. A pathologist reviews and interprets the results of a blood smear that was prepared and stained at an outside hospital's laboratory. The pathologist was not involved in the technical preparation of the slide. Which modifier should be appended to the appropriate CPT code? A. TC. B. -26. C. -90. D. -52. Answer, B, -26. This question tests the understanding of professional and technical components in pathology services. The keyword is interprets, indicating the pathologist is only providing the physician's work, not the technical work of running the test or preparing the slide. Modifier -26, professional component, is used to report that only the pathologist's interpretation and report were provided. The facility where the slide was made would bill for the same CPT code with ATC, technical component, modifier to cover their costs for equipment, supplies, and technicians. Think of it like this: if the pathologist only reads the results, use modifier -26. Question 5. A 45-year-old male is prescribed a medication that can be toxic to the liver. His physician orders a repeat alanine aminotransferase (ALT) test at 4 p.m., following an initial abnormal result from a test performed at 8 a.m. the same day to monitor the drug's effect. How would the second ALT test be reported? A. 84,460. B. 84,460 to 76. C. 84,460 to 59. D. 84,460 to 91. Answer, D. 84,460 to 91. This question focuses on the correct use of modifiers for repeated lab tests. The crucial information is that a repeat clinical lab test was performed on the same day to monitor the patient's condition. Modifier -91, repeat clinical diagnostic laboratory test, is specifically designed for this scenario, indicating that a subsequent test was medically necessary and not just a duplicate billing error. For example, a diabetic patient's glucose might be tested multiple times a day to adjust insulin dosage. Remember to use modifier -91 for repeat lab tests, while modifier -76 is used for repeat procedures or services by the same physician. Question 6. A physician performs a fine needle aspiration, FNA, of a thyroid nodule without imaging guidance and sends the specimen to the pathologist. The pathologist evaluates the adequacy of the specimens during the procedure and then provides a final interpretation and report. How should the pathologist's services be coded? A. 10021, 88173. B. 88172, 88177. C. 88173, 88177. D. 10021, 88172. Answer, B. 88172, 88177. This question assesses coding for fine needle aspiration, FNA, interpretation and adequacy evaluation. The key is to separate the pathologist's work from the physician who performed the aspiration. The pathologist's service of evaluating adequacy, checking if the sample is sufficient for diagnosis, is reported with 88172, and the final interpretation and report for the first lesion is reported with 88173. However, CPT guidelines state that 88173 is an add-on code to be used with the primary FNA biopsy procedure code, 10004 to 10021, and since the pathologist did not perform the biopsy, 88173 cannot be used. Instead, the pathologist reports 88172 for the adequacy evaluation and 88177 for the final interpretation of the FNA smear. Always check the CPT parenthetical notes to understand which codes can be reported together. Question 7. A lab performs a test using immunofluorescence to detect the presence of an antinuclear antibody, ANA, using a titer method. What is the correct CPT code for this service? A. 86038. B. 86039. C. 86,255. D. 86,235. Answer, A. 86038. This question tests your knowledge of specific immunology CPT codes. The keywords are antinuclear antibody, ANA, and titer, which point directly to CPT code 86038. This code describes a screening test for autoantibodies, often the first step in diagnosing autoimmune disorders like lupus. Code 86039 is used for a follow-up ANA test that includes a specific pattern analysis, which is a more detailed service than what is described. The takeaway here is to pay close attention to the specific details in the lab order, such as screen versus titer or pattern, as they lead to different codes. Question 8. A pathologist is asked by a clinician to review a complex hematopathology case, including examining peripheral blood smears and bone marrow aspirates prepared at another facility. The pathologist provides a comprehensive written report with a diagnostic conclusion. Which CPT code range is appropriate for this consultation service? A. 80,500 to 80,502. B. 88,321 to 88,325. C. 99,241 to 99,245. D. 85,060. Answer: B. 88,321 to 88,325. The concept tested is the difference between various types of pathology consultations. The keywords review, case, and prepared at another facility indicate a consultation on referred materials, which falls under the 88,321 to 88,325 code series. These codes are used when a pathologist provides a second opinion on slides or specimens from an outside source. The 80,500 to 80,502 codes are for clinical pathology consultations that are not based on reviewing a specimen, while E/M codes, 99,241 to 99,245, are for patient encounters. Always distinguish between a clinical consult, discussion/advice, and a specimen-based consult, review of slides. Question 9. A hospital laboratory performs a presumptive drug screening test using a multi-class drug screening cup that checks for 10 different drug classes. The result is read directly from the cup. Which CPT code range should be used to report this service? A. 80,305 to 80,307. B. 80,320 to 80,377. C. G0480, G0483. D. 80,150 to 80,299. Answer: A. 80,305 to 80,307. This question differentiates between presumptive and definitive drug testing. The key clue is presumptive drug screening, which refers to simple, qualitative tests, positive/negative, that are not highly specific. The CPT code range 80,305 to 80,307 is used for these types of tests, with the specific code chosen based on the method, e.g., dipstick, cup. The G codes are for definitive drug testing, which is a much more complex quantitative analysis, and the 80,320 to 80,377 range also applies to definitive testing for specific analytes. Remember, if it's a simple screen, think 80,305 to 80,307. If it's a complex confirmation test, like gas chromatography, look to the definitive testing codes. Question 10. A specimen is sent to pathology with the descriptor fragments of skeletal muscle. The pathologist performs a gross and microscopic examination. According to the CPT manual's list of specimens, which surgical pathology level is this? A. 88,302. B. 88,304. C. 88,305. D. 88,307. Answer: C. 88305. This question requires you to correctly assign a surgical pathology CPT code based on the specimen type provided. The CPT codebook provides explicit lists of tissues that correspond to each pathology level, 1 to 6. Skeletal muscle biopsy is specifically listed under the examples for CPT code 88305, Level 4. The levels represent increasing complexity and work required by the pathologist. For example, a simple nerve specimen, Level 3, 88304, is less work than a complex tumor resection, Level V, 88307. The best way to answer these questions is to become familiar with the specimen lists for each level in your CPT manual. Question 11. A lab performs a culture of a throat swab to identify the specific organism causing a patient's pharyngitis. The culture grows group A Streptococcus. What is the correct coding for this service? A. 87,070. B. 87,430. C. 87,081. D. 87070, 87077. Answer: A. 87070. This question tests your knowledge of microbiology coding for cultures. The key term is culture, to identify the specific organism, which describes the work of CPT code 87070, culture, bacterial, aerobic, with isolation and presumptive identification of isolates. This single code includes the work of growing the bacteria and performing a basic identification. Code 87430 is for an antigen detection test, a rapid strep test, not a culture, and 87081 is a screening culture, not one for definitive identification. Think of 87,070 as the go-to code when the goal is to grow and identify a specific aerobic bacteria from a source. Question 12. A pathologist examines a colon biopsy and, in addition to the routine H&E stain, performs a special stain, Alcyon blue, to evaluate for mucin abnormalities. How would the special stain be coded? A. It is included in the surgical pathology code. B. 88,312. C. 88,313. D. 88,342. Answer: B. 88312. The concept tested here is the coding for ancillary pathology services, specifically special stains. The clue is special stain, Alcyon blue, which is performed in addition to the standard hematoxylin and eosin, H&E, stain. CPT code 88312 is used for the first special stain for microorganisms, e.g., fungi, bacteria, but the CPT manual has expanded its use to include stains for other substances like mucin. This code is reported in addition to the primary surgical pathology code, e.g., 88305 for the colon biopsy. Always remember that special stains, immunohistochemistry, 88342, and other advanced studies are coded separately from the initial gross and microscopic examination. Question 13. A hospital's blood bank performs a service to determine a patient's ABO group and Rh type. Which CPT code should be reported for this blood typing service? A. 86,850. B. 86,900. C. 86,901. D. 86,920. Answer: B. 86900. This question is about transfusion medicine coding, specifically blood typing. The keywords determine a patient's ABO group and Rh type describe the service for CPT code 86900. This is a fundamental test performed before any blood transfusion to ensure compatibility. Code 86901 is for Rh phenotyping, a more detailed analysis beyond the basic Rh-D type. For example, when a patient needs a blood transfusion, the lab first performs an 86,900 to find their basic type, like A+, and then an 86,920 cross-match to test their blood against a donor unit. To keep it simple, think of 86,900 as the code for standard, basic blood typing. Question 14. A pathologist performs only a gross examination of a hernial sac from an adult patient. No microscopic examination is performed. Which CPT code should be used? A. 88,300. B. 88,302. C. 88,304. D. Not billable, as no microscopic exam was done. Answer: A. 88300. This question tests the coding for a gross examination only, a unique pathology service. The key phrase is only a gross examination, meaning the pathologist visually inspected and described the specimen but did not prepare or examine a slide under a microscope. CPT code 88300, surgical pathology, gross examination only, is specifically designed for this scenario. This service is appropriate for specimens that are submitted for documentation but are not expected to show disease, like a hernial sac or normal appendix. Remember, if there's no slide, you can't use the standard surgical pathology codes, 88,302 to 88,309, you must use 88300. Question 15. A lab performs a test to determine the level of a specific therapeutic drug, digoxin, in a patient's blood. Which CPT code range would this test be found in? A. 80,150 to 80,299. B. 80,305 to 80,307. C. 82,000 to 84,999. D. 86,000 to 86,849. Answer: A. 80,150 to 80,299. The concept being tested is therapeutic drug monitoring. The keywords therapeutic drug and digoxin point you to the therapeutic drug assay's CPT code range, 80,150 to 80,299. This section contains codes for measuring the levels of specific prescribed medications to ensure they are within a safe and effective range. For example, a patient on the heart medication digoxin would have their blood tested periodically, coded as 80162 for digoxin, to prevent toxicity. The chemistry section, 82,000 to 84,999, is for general body chemicals, not specific medications, so it's important to navigate to the correct CPT section for drug assays. Question 16. A patient provides a urine sample at a clinic. The medical assistant performs a dipstick urinalysis, checking for glucose, protein, etc., and also prepares a slide of the urine sediment for microscopic examination. Which CPT code represents this complete service? A. 81,000. B. 81,001. C. 81,003. D. 81,015. Answer: D. 81015. This question tests your ability to differentiate between the various types of urinalysis. The key details are dipstick urinalysis and microscopic examination. CPT code 81015, urinalysis, microscopic only, is the correct choice, as it describes the physician or other qualified healthcare professional's examination of urine sediment under a microscope. The dipstick test would be coded separately with 81003, urinalysis, automated, without microscopy. A simple way to remember is that 81015 is for the microscopic part, while 81,000 to 81,003 are for non-microscopic or automated tests. Question 17. An automated complete blood count, CBC, with an automated differential white blood cell, WBC, count is performed. What is the correct CPT code for this combination of tests? A. 85,025. B. 85,027. C. 85004, 85027. D. 85,007. Answer: A. 85025. This question focuses on correct coding for common hematology tests, specifically the complete blood count, CBC. The important phrases are complete blood count, CBC, and automated differential WBC count. CPT code 85025 describes this exact combination of services. Code 85027 is a CBC without a differential, and reporting the components separately, like 85004 for the differential and 85027 for the CBC, would be incorrect unbundling. For instance, a routine physical exam often includes an 85025 to get a comprehensive picture of a patient's blood health. Remember to choose the single code that best describes the complete service performed. Question 18. A pathologist uses computer-assisted technology to perform an analysis of a biomarker on a breast cancer tissue sample. This is the first single antibody stain procedure. Which CPT code would be used? A. 88,342. B. 88,360. C. 88,361. D. 88,341. Answer: B. 88360. This question tests the coding for morphometric analysis, a specialized pathology technique. The key terms are computer-assisted technology and analysis of a biomarker, which describe the service of CPT code 88360. This code is for nerve morphometry, which involves using a computer to measure features like cell size, shape, or number, often to quantify things like hormone receptor status, e.g., ER/PR, in cancer tissue. Code 88342 is for standard immunohistochemistry, IHC, staining, while 88360 represents the additional computer analysis of that stain. Always check if a computer was used for quantitative or semi-quantitative analysis, as this points to the morphometric analysis codes. Question 19. A surgeon is unsure if the margins of a resected tumor are clear of cancer cells and requests a formal consultation from the pathology department after the surgery is complete. The pathologist reviews the slides and provides a written report. This is not for a second opinion on outside material. Which CPT code should be reported? A. 80,502. B. 88,329. C. 88,331. D. 99,251. Answer: B. 88329. The concept tested here is postoperative pathology consultation on an in-house case. The critical clues are consultation, after the surgery is complete, and that the pathologist is reviewing slides from their own institution. CPT code 88329, pathology consultation during surgery, describes a consultation requested by a surgeon to review a specimen from the same facility, but not on an immediate/intraoperative basis. Code 88331 is for an immediate intraoperative, frozen section, consult, and 80502 is for a clinical pathology consultation that doesn't involve reviewing a specimen. Think of 88,329 as the code for a formal, non-urgent second look requested by a surgeon on a specimen from their own hospital. Question 20. A lab receives a cervical smear collected in a liquid-based preservative, e.g., ThinPrep, and uses an automated system to screen for abnormalities, with manual review by a cytotechnologist. How is this service coded? A. 88,142. B. 88,150. C. 88,164. D. 88,175. Answer: D. 88175. This question addresses the coding for modern Pap tests, a form of cytopathology. The key phrases are liquid-based preservative and automated system for screening, which point directly to CPT code 88175. This code represents a Pap test using an automated thin-layer preparation method combined with automated screening and manual review. This technology differs from older, conventional smears, 88150, or manual screening of liquid-based preps, 88142. For example, many clinics now use liquid-based systems like ThinPrep or SurePath, which are coded with the 88142 to 88175 series, so it is important to identify the technology used. Question 21. A patient with suspected Cushing's syndrome undergoes a low-dose dexamethasone suppression test. The lab draws blood for a cortisol level before the patient takes the dexamethasone and again the next morning. How would the lab work be coded? A. 80,406. B. 82,533 x 2. C. 80,420. D. 82533, 82,533 to 91. Answer: D. 82533, 82,533 to 91. This question is about coding for evocative/suppression testing, which involves measuring a substance before and after administering an agent. The key is that the panel codes, like 80406, include the physician's supervision and administration of the agent, not just the lab tests. Since the question only describes the lab drawing and testing for cortisol, you must code for each cortisol test individually using CPT code 82533. The second test on the same day would require modifier -91 to indicate it was a medically necessary repeat test as part of the suppression protocol. Remember, only code for the services performed. If the lab only does the tests, you only code for the tests. Question 22. A pathologist performs a quantitative analysis for human epidermal growth factor receptor 2, HER2, gene amplification using in situ hybridization, ISH. This is the initial single probe stain procedure. How should this be coded? A. 88,342. B. 88,365. C. 88,374. D. 88,271. Answer: C. 88374. This question tests your knowledge of advanced molecular pathology techniques. The keywords are in situ hybridization, ISH, and gene amplification, which are specific to the 88,373 to 88,377 CPT code series. CPT code 88374 is used for morphometric analysis, an in situ hybridization test where a computer helps with the manual count, for the initial single probe stain procedure. Code 88365 is also for ISH but involves a manual count, not a computer-assisted one. It is crucial to distinguish between immunohistochemistry, IHC, 88342 series, and ISH, as they are different technologies used to analyze tissue. Question 23. A patient is brought to the hospital and an autopsy is performed to determine the cause of death for public health purposes, as the patient had a suspected infectious disease. The examination is limited to the brain and thoracic organs. Which CPT code should be reported? A. 88,000. B. 88,014. C. 88,025. D. 88,045. Answer: D. 88045. The concept being tested is autopsy coding. The critical clue is that this is a forensic examination, which the CPT codebook defines as cases for legal or public health purposes, even if ordered by a physician. Code 88045 is specifically for forensic autopsies. The standard clinical autopsy codes, 88,000 to 88,029, are used when the purpose is purely medical, such as confirming a diagnosis for the family or for educational purposes. For example, an autopsy performed at the request of a medical examiner to investigate a potential crime would also use 88045. Remember to distinguish the purpose of the autopsy, clinical versus forensic, before selecting a code. Question 24. A patient with a family history of colon cancer is given a take-home fecal occult blood test, FOBT, kit during a preventive visit. The patient completes the test at home and returns it to the lab for analysis. Which HCPCS Level II code reports this screening test? A. 82,270. B. 82,274. C. G0107. D. G0328. Answer: D. G0328. This question tests your knowledge of HCPCS Level II codes for specific screening services covered by Medicare and other payers. The keyword is screening, and the scenario describes a fecal occult blood test performed via immunoassay. While CPT has codes for FOBT 82270, 82274, Medicare requires the use of a specific G-code for colorectal cancer screening. Code G0328 is used for a fecal occult blood test via immunoassay, which is a common method. It's crucial to be aware of payer-specific coding requirements, especially for preventive and screening services where HCPCS codes are often used instead of CPT codes. Question 25. A urologist submits 3 separate bladder biopsy specimens, each in a separately labeled container, from different locations within the bladder, e.g., right wall, left wall, dome. How should the pathologist's service for the gross and microscopic examination be coded? A. 88,305. B. 88,305x3. C. 88305, 88,305 to 59, 88,305 to 59. D. 88,307. Answer: B. 88,305x3. The concept being tested is how to code multiple surgical pathology specimens. The key detail is that 3 separate specimens were submitted in separately labeled containers. According to CPT guidelines, when multiple specimens are submitted from different sites, each is coded and reported individually. Since a bladder biopsy is a Level 4 service, 88305, and 3 distinct specimens were examined, the code 88305 would be reported 3 times, or with 3 units of service. If the biopsies had all been in one container, they would have been treated as a single specimen. Always check if specimens are separately identified and containerized, as this determines whether you bill once or multiple times.